being recorded, so you will be able to access this video recording afterwards. Further details of that will follow. Welcome everybody. My name is Jennifer Moss-Langfield. I'm one of the GPs who work for the Nottingham and Nottinghamshire Clinical Commissioning Group as a lead GP for maternity and also on the vaccination programme. Welcome to one of our COVID-19 vaccination community conversations, focusing today on vaccination in pregnancy. Today I have got, next slide please, got Professor Jim Thornton with me, along with Dr. Andre Ellis and Dr. Susie Al-Samurai, all of which who work at Nottingham University Hospitals and Sherwood Forest Hospitals. They're our local obstetric and gynecology colleagues. We also have some of the staff from the CCG here as well helping. We have Katie and we have Sarah. Next slide, please. So an outline of the session today. We're going to mainly be focusing on questions. So if you do get any questions coming up at any point throughout this session, please just add them through using the question and answer function, which is at the bottom of your screen. We can then go and pull those questions through and we'll be asking questions through to our panelists. We will be live streaming this, as I said. It'll be going onto the CCG YouTube channel and we'll be able to share this through all of our communities and networks. We will attempt to answer as many of your questions as possible, but we will be pulling them all together so we don't get too much duplication. And anything that we don't manage to answer today, we can put into a frequently asked document at the end and we can share that at the end. So all information from today is accurate as of today. It has been a quite fast moving programme, which Jim will go into later. And we have been dealing with some of the evidence changing as we're going through. So we want to be able to give you the most up-to-date version of things. Next slide. So first off, we're going to start with going through COVID and pregnancy with Andre, who's going to go through some of those more in-depth details for you. Over to Andre.
So you may ask why are we particularly talking about this at the moment when the government is talking about ending all social distancing measures on the 19th of July. And the reason is that, as we know, the Delta variant is more highly infectious and is spreading rapidly. And it's spreading rapidly in Nottinghamshire. Lockdown measures and social distancing have been relaxed. And in the unvaccinated population, this is the group that's at risk, obviously, for the Delta variant to spread most rapidly. We now know that pregnant women appear to be a vulnerable group for COVID. This is new information. We didn't know this in the first wave, but in the second wave, it became quite obvious that pregnant women are a vulnerable group. They have an increased risk of being admitted to hospital and to ITU relative to non-pregnant women of the same age. And also we now know that there are increased risk of poorer outcomes for pregnancy. There's 3 times the risk of preterm delivery if you get infected with COVID during pregnancy. Could I have the next slide, please? So women ask, how can I reduce the risk to my baby and myself? But the good news is social distancing does work. We've learned this over the last year. Hands, face, space, fresh air, those things do work. It's also important that you attend all your antenatal care. So don't be frightened of coming into the hospital or to antenatal clinics, because all these healthcare facilities follow COVID safe practices. We do recommend that you consider lateral flow testing for both yourself and your partner twice a week, which is freely available and easily accessible. But however, if you're symptomatic, then make sure that you get a prompt PCR test and tell your GP, midwife and labour ward if you get a positive swab. And lastly, of course, the topic of this webinar, which is about vaccination. Now, this is now strongly recommended by the RCOG, RCM and the JCVI for all adults, including women who are pregnant. Next slide, please.
And for those of you who may have got a little bit confused with all the acronyms, we have the Royal College of Obstetrics and Gynecology, the Royal College of Midwives, and the JCVI. Oh, we'll go through, I've forgotten what they stand for, the Joint Vaccination and Immunisation Committee. Now, key messages. If you are 18, it is now your turn. You can come and get vaccinated. Or if you're a bit younger, 16, 17-year-olds who are in a risk group, if you're a carer or a social care worker or a healthcare worker, but younger than 18, you can get vaccinated. And we've changed the way we do things here on the vaccination programme. You can just walk in to any of the sites to get your first vaccination, as long as you are 18 or one of the at-risk groups. And you can also walk in to get your second dose if you've had your first dose and you are now due your second dose. And we have 8 weeks or 56 days as the first time where you can have your second dose. And it is so important for us to get people vaccinated. We know that with the first vaccine, we get about 33% immunity for the Delta variant. It was much better with the previous variants, but with the Delta variant, we have a little bit less immunity coming through. So it's super important to come and get that second dose, which boosts the immunity all the way up with Pfizer up to about 88%, which is absolutely phenomenal and a massive difference. So it's really important we get you to come in and get that second dose of your vaccine if you're due that as well. So if you're due your first, haven't had come forward, or you're due your second, you can come. And there's lots of sites: the Forest Recreation Ground, Kings Meadow Campus, which is near QMC, and the old Carlton Studios, Gamston Community Village. And then up further north, we've got Ashfield Health Village, which is in Kirkby and Ashfield. The Newark Showground has got one of our vaccination sites in there. And also back down in Carlton, we've got Richard Herod Centre, and we have one in Mansfield near the old former Wicks site. And then obviously the two main big hospitals, QMC and the Kingsmill Hospital sites, both got walk-in sites there as well. So you can go and find information on what hours these sites are open down on the website below, which is notccg.nhs.uk. Next slide, please. So, as I said before, that new analysis by Public Health England does show that the 2 doses of COVID are highly effective against hospitalisation from Delta variant. And that's actually over 90% of people who've had both doses, if they do contract COVID, will not need to go into hospital. They will not become that unwell, which is phenomenal. And we'll hear later from Boris as to what the latest outcomes that are a result of people getting vaccinated. If you are pregnant, or you think you're pregnant, or you're trying to get pregnant, or you think you might get pregnant in the future, you can still get vaccinated. In fact, as Andre said earlier, you would be in a higher risk group if you did become pregnant or you were pregnant. So we would want you to come and get vaccinated to help protect yourself and your baby. There is absolutely no evidence that the COVID vaccines have any effect on your chance of becoming pregnant, either for men or women. There's no effect on fertility, and there's definitely no need to try and avoid getting pregnant after being vaccinated. But you can't catch COVID from any of the vaccines. They're not live vaccines like that, and you can't pass it on to your baby through your breast milk. However, if you are breastfeeding, the vaccine can actually pass immunity through to your baby through breastfeeding, which is phenomenal. And it's a wonderful opportunity to be able to give your child a little bit of immunity when they cannot have the vaccine themselves. The vaccines that if you're breastfeeding, the vaccine you can have depends on your age. If you're over 14, you could have any of the vaccine. But if you're under 40, we're only giving either Pfizer or Moderna. If you're pregnant, we're only giving Pfizer or Moderna also. And that is based on the evidence that has been found through all the studies that have been done over in America, where they've been given Pfizer and Moderna for a long time, since December. Next slide, please. So I'm going to hand over to Jim now, who's going to go through some more of that evidence. You're muted, Jim.
Sorry. Thank you, Jen. I'm not sure if I'm on the camera, but I hope you can hear me. I'm Professor Jim Thornton. I'm the Professor of Obstetrics and Gynae here in Nottingham, and I've been keeping an eye on the research evidence. And I just want to endorse what you've heard up to now from Jen and Andre. Basically, the two main committees, the Royal College of Obstetricians, who are the experts on pregnancy and risk in pregnancy, and the Joint Committee on Vaccinations, they are absolutely agreed that we should be offering vaccination in pregnancy now. That view has changed. Last year, there wasn't much experience, and pregnant women were advised to avoid the vaccination, but experience has increased. And earlier this year, the advice was cautious advice to give it to pregnant women who also had a risk factor. But the evidence has increased even more now, and from the 16th of April, the advice from all the experts is that all pregnant women should be offered the vaccine at the same time as their age rollout. People sometimes say to me, is there any evidence, Professor? Are you sure there's evidence? Well, next slide, there's loads. And here it is. There's been, well, I've been collecting it, and I'm sure I haven't found everything. There's about 46 properly peer-reviewed publications. And in the USA, well over 100,000 pregnant women vaccinated. Big academic reports. The biggest one of all is 35,000 vaccinated pregnant women in America, studying in detail and showing that there's no adverse effects. Those pregnancies had the same outcomes as control pregnancies. And similar numbers, a little bit smaller from the UK. And in fact, all of these numbers are out of date. They're increasing all the time. And also from other large countries. So really, I'm here to endorse the advice and say that it genuinely is based on proper research. I'm going to hand over to the next speaker now. Sorry, back to Jen.
Yes, it's coming back to me. So we are aware that there's a lot of misinformation being going around about the vaccine. And actually, one of the most important things that I find as a GP is telling my patients not to ignore the internet. I don't believe that at all. I think that people should be able to look at the internet, but it's about how to find the right information so that you can assess things properly rather than having less credible information. So NHS websites are really quite good at having the correct, up-to-date, accurate, trustworthy information on. So you can have a look at a really good website. And what we'll do is we'll put some of these in the chat actually on, in the answers to the questions. So if any of you are on your laptop, you can just go and click on them. But if you just Google NHS England and NHS Improvement London, COVID-19 vaccine communication materials, you'll get a really good raft of very, very good information there. Obviously, the government website has got some amazing good information, the .gov ones, especially that and the COVID-19 vaccination, women of childbearing age, currently pregnant or breastfeeding. And our own Royal College of Obstetric and Gynecologists, RCOG, has a really good toolkit there, and they did a really good webinar a couple of months ago. It was actually, I think it was just about the time where they, I think it was the 14th of April, actually just before they changed the guidance there. So you can have a little look at that and look at some of the experts going through the evidence, just as Jim has done with us now. And the British Fertility Society has got a brilliant fact sheet. And if they have BBC Asian Network has got a really good advice on COVID and pregnancy in 5 Southeast Asian languages. And we'll post all of those underneath the YouTube video when we do pop this up. We also have our own social media pages at NHS NOPS CCG. Next slide. So we're going now to go through all the questions. So I'm going to go hand over to Katie, who's going to take us and talk us through the questions that have come up so far. And I can see we've got a few.
That's great. Thanks, Jen. So the first one that's come in is, I'm aware that getting a fever is a potential side effect for the COVID vaccine and that getting a fever in pregnancy can be a serious concern. What are the potential risks of having a fever during pregnancy? The person that's put this is saying that this is their main concern, and have read that those who have had COVID-19 may be more likely to have side effects from the vaccine. And this person is currently 13 weeks pregnant.
Can I take that one? I think it is true that there is a small risk of fever after vaccine, but I think the important thing to remember is there's a much, much higher risk of fever after COVID, and you know, the risks of COVID are just astronomically higher. Now, I appreciate the risk of getting COVID is relatively low, but it's still much, much safer to have the vaccine than COVID. And the studies, which are large studies, didn't show any adverse effects on the babies from tens of thousands of vaccinated pregnant women. So even if there were some small fevers, they weren't causing problems. So, you know, I think the evidence shows that the fever isn't a problem fever and that the risks from COVID are a great deal greater.
Great, thank you, Jim. So the next one may be over to you again, Jim. So it's around what research is there for women trying for a baby having vaccine and the effects that might have? I have huge anxieties about getting the vaccine.
Right, there's relatively small numbers of people who have had the vaccine and got pregnant after. Well, I mean, there's been plenty of people who've had the vaccine and got pregnant afterwards. There's only, I think, been one study which has looked at the pregnancy rates afterwards, but that was quite recent. I read it, you know, a week or so ago, and you know, everybody who wanted to get pregnant got pregnant in the normal time scale. So there is no evidence that the vaccine causes infertility. And there's no real theoretical reason why it should. The scare on Twitter about it is due to a scientist somewhere in Germany who said that the spike protein has some similarities to some of the placental proteins, and of course it does, but there was no logical theoretical reason why the vaccine should have any harmful effect on the placenta or on the endometrium, and there's no practical evidence that it does so in general. So you know, I've read it and taken advice from other experts, and they're all giving the same advice. There is no fertility harm from the vaccine.
And that's been actually also been stated by one of our fertility experts who was on our last webinar, who confirmed there's absolutely no link to any infertility following this vaccine. We have no evidence at all of that. And the science doesn't really follow through particularly well for it either. Does anyone else have any comments?
Only to completely agree with that, Jen, that there has been no evidence of subfertility following on from from having had the vaccine. There's another question further down. I'm jumping ahead now, Katie. Sorry, around menstrual disorders that are linked potentially to the vaccine, and similarly, there isn't any evidence to support there being a mechanism by which you would have a vaccine that could cause your periods to become, having gone from being normal to becoming abnormal. So it's difficult to fit it with the science that sits behind our menstrual cycles, and certainly there's no evidence to bear out that there should be any cause for concern with it.
I'd come in on this one. As a GP, I have a lot of people who come to talk to me about problems with their menstrual cycle. And only today I had someone who'd had COVID and had a delayed menstrual cycle. I've had people who've never had a vaccine and have had delayed menstrual cycles. And I've had people who have had vaccines. And I think I've seen one person who has that. I think actually what we're seeing is that menstrual cycles are a little bit tricky and are very unpredictable and like to keep us girls on our toes. And probably it will be very hard to find anything that's more than that. Although I do believe the Royal College has said that any vaccine can slightly upset your hormones in general, and sometimes you can have a little bit of a wibbly cycle essentially for a couple of months afterwards. But it's really whether that would be any more than a background rate, I think, would be questionable.
Great, thank you. We've got a question here from somebody who's already had their first dose and they were fine with no symptoms. They've currently got a second dose booked in, which is 12 weeks after the first one, but they want to know if they can bring it forward to the 8-week gap instead, and is that safe during pregnancy? And if I bring it forward, I'll have the second dose when I'm 35 weeks pregnant, which allows for 4 to 5 weeks before the baby is due. Do we need to do anything specific when we schedule in the appointments, if so?
No, absolutely not. Just walk. As soon as you hit, exactly 8 weeks, you walk through the door saying, please jab me. I'd like as much protection for myself and my baby as possible. So I want it now. We can't do it before. Unfortunately, we can't do it any earlier than 8 weeks. And that's actually also borne out by the science. And that's showing that when we do leave a larger gap between 2 vaccinations, we do get a better immune response. So we do want to leave 8 weeks. And that for some women will mean that that second vaccination will hit after you've finished being pregnant. And that's not a reason to bring it forward. But we do want you to get yourself vaccinated out 8 weeks. I think that would be very sensible for you.
That's great, thank you. Another question around restrictions that are currently in place for pregnant people and their birthing partners. Is that likely to change if they've had both vaccinations?
I don't think the restrictions are likely to change based purely on vaccination status. I think we're going to have to be led by what the national steer is with regards to having numbers of people in a restricted environment, and obviously taking into account the individual sort of vulnerabilities of all of the women and their newborn babies on a postnatal ward. I have absolutely the highest sympathy with anyone who is having to stay on a postnatal ward without the support of their birthing partner. But we have to make sure that we're following the safest advice for everybody. And unfortunately, it can't just be down to individuals and their vaccination statuses. So we are waiting a little longer for some absolute guidance and some steer with regards to that.
I'd like to say, as someone who actually gave birth during the pandemic as well, these restrictions actually were just starting to come in. I do understand how difficult and challenging it is, but also how important it is to make sure that everyone stays as safe as possible, especially given the increased risk to mothers who maybe they're being monitored before they're giving birth as well, or just coming in. So it's not just people who are actually giving birth there. So it's very important we protect women. It's very important that as many women who can get themselves vaccinated, because that is decreasing their chances of catching COVID and having COVID during that period, that last bit of pregnancy, where that might make them go into an earlier labour than they would, and the evidence saying that they're 3 times more likely to do that, or have a baby that ends up on the neonatal unit, which again is increased risk. So it's so important that if you can, to get yourself vaccinated.
I would also just like to say it's been a really good idea for your partners to be vaccinated as well. So, and as I said earlier on about the lateral flow programme, because if you know that you're going to be coming into a healthcare facility, and obviously more women than partners who are coming into our units have been vaccinated and using lateral flow testing, then the safer for all the service users that come into our hospitals and indeed healthcare clinics.
Yes, I mean, that's a very good point, and I endorse all the points. What we really don't want is for hospitals to become a site of transmission. That would be just awful if people were coming into hospital and getting infected. I don't think they are at the moment, but that's the reason for those restrictions, which do seem harsh, but they're there for a very good reason.
We've got another question here. Well, we've had a couple around when would you say is the best time to get vaccinated in pregnancy? We've got one lady who's 14 weeks pregnant but feels it's still a little early, and then we've got another one who's 33 weeks pregnant as well, and they were just wondering when's the best time to get their vaccinations. Today's
best, tomorrow will do.
Exactly. I'll just come in because obviously, because of the interval, the important thing is trying to get the 2 doses in as soon as possible. We do know that the 3rd trimester is the sort of highest risk time, but any time during pregnancy obviously is at higher risk. But to get both doses in so that you've got some immunity on board for the 3rd trimester, but if you're late in pregnancy, 1 dose will give you a good degree of protection as well. So even if you are in the 3rd trimester and only thinking about being vaccinated now, then I would go along and have your first vaccination.
And if you are going to breastfeed, that might give your newborn baby a little bit of immunity as well. It's never too late to get vaccinated. And if you've just had a baby, but you didn't get vaccinated in pregnancy, please still come and roll up and get vaccinated.
The other thing to say is that obviously if you're vaccinated in the 3rd trimester, you will produce antibodies which will cross the placenta. So even if you're not intending to breastfeed, your baby will be born with a dose of antibodies and protection at birth. Same principle as the whooping cough vaccine.
Okay, we've got a question here. Is it true that women have been advised not to conceive for 1 year after having the vaccine?
No.
Tosh. I can't think of any reason why that would be sensible to do. That's not science. That's not fact. That's misinformation.
And in fact, if we're going to be rolling out boosters, that would mean you'd never have a chance to have a baby, essentially.
Makes no sense at all.
We've got a question from a midwife sonographer who's asked, when they've been asked to give out the information regarding vaccine in pregnancy so far, they've been asked to speak to a GP or have a look at the RCOG website. Is there a specific leaflet that is recommended to give to patients?
Well, there's the toolkit from the RCOG, which we can give out, and I think it may be being already given out or a link to it with the booking information. I think that's actually what we're asking to be given out, and that's because it allows women to access the information, the frequently asked questions, so that because every woman's got their own questions. And we want people who've got their questions to either come to events like this and ask them, or have a good resource where they can go and find the answers out for themselves, which is why I'm pro people going onto the internet and finding out what's what, but using the sensible, good information resources that are available.
Okay, is the vaccination ASAP still the case if you are high pregnancy or if there is a specific number of weeks recommended? I think we've touched on that, but I think it was just around the high risk pregnancy area, Jen.
I think we'd go again. So the higher risk you are in your pregnancy, the higher risk essentially if you catch COVID as a general rule. So the more reason to get vaccinated as early as possible so that you can get as much immunity as possible so that you can transfer that to your unborn child through the placenta or breastfeeding, but also protect yourself from becoming unwell during pregnancy and labour.
Great. I'm just conscious we're running a little bit over, so there is another question. If we could just touch on this one around, do you have to leave a gap between your COVID vaccination and other vaccinations, such as whooping cough? And if so, how long should this gap be?
7 days. So we need to leave. Sometimes there may be an exception with the flu vaccine, which potentially in the booster program may be given potentially at the same time. We do not know that yet. We don't know whether we will be able to do those two at the same time, but we definitely know we need to leave 7 days in between that the COVID vaccination and any other. We don't need to leave any longer though. It can just be 7 days. So if you have your whooping cough vaccine when you go in for your 20-week scan, for example, you can get your booster for COVID a week before or after, or the other way round, of course, because you can access these vaccines at your GP surgery. So the COVID vaccination, we're not sure where that's going to be available, but the whooping cough vaccine, you can get that from a farm. No, you can't get it from a pharmacist. I'm telling Porky, sorry. You can get it from your GP.
Okay, we have got other questions that are coming in on the chat. Are you happy to continue, Jen, if they're...
Absolutely.
Yep.
If people have got more questions, I'm happy to carry on answering. I think I'm speaking for everyone.
Could I just add in that from the response before that, of course, the reason that we don't give it at the same time is just so that we can tell if there's a reaction to the vaccination, so that it can be reported. It's not that we don't think it's safe to give 2 vaccinations at once. It's just so that we can tell the effects of one vaccination from the other, and the 7-day gap.
Absolutely correct.
Okay, there's a couple of questions that have come in on research about how much research has there been into the effects of any babies born to mothers who have had the vaccine, and also the research that has been carried out, has this included ethnic communities as well?
I think we can answer the latter one quite easily. Most of the research has been in the USA, and it has therefore included a lot of members of ethnic minorities. With regard to baby follow-up, obviously babies haven't been followed up for very long because the vaccine simply hasn't been given that long. But there's no reason to anticipate any adverse effects from a baby of getting nice healthy antibodies from their mother. It just, there's no logical reason whatsoever. And there's, with other vaccines and similar vaccines like flu, there's lots of evidence that they're safe.
Yeah, I would just completely agree with that. Although the timing is obviously that we don't have the longevity of the research, there is not only no evidence, but there is, based on the knowledge, the vast amount of knowledge we have of vaccination in pregnancy. We've been doing a flu vaccination for over 10 years. The vaccination in pregnancy for these types of vaccine is safe.
Thank you. We've touched on the information sheets, and it's what information sheet would you recommend to give to pregnant people from today after talking to them in ANC about the vaccine?
That's that RCOG toolkit one. I think we could we put that in the chat, in the link?
Yeah, certainly will. Yeah, and we will share all the slides following on for all attendees as well. So they'll have all the URL links when we send that out to them. So I think I've covered the majority of questions, Jen, so I'll hand over to you.
Right, well, guys, it's been an absolute pleasure to have you all here today. It's been so good to see so many of you, and I'm so grateful to Andre and Susie and Jim and Katie and Jane in the background and Sarah, all helping get this webinar up and running and answering as many of your questions as you have. Now, some of you may have had some questions that you haven't either felt up to putting into the question and answer bit, but you can contact us. Katie, can you put in the chat, in the question and answer, the link, so that if they have any other questions, they can just send them through to us so we can get some answers to you. The other way that you can get some answers to any questions that you have is to go and have a chat to your midwife. or your obstetrician, your doctor, or your GP. And many of the GPs and midwives are actually working on the vaccination programme and are reasonably expert in this. So if you have any questions, don't just sit on them. Please to stand up. Come down to one of the vaccination sites, actually, because every vaccination site, we've got a GP who's there waiting to be asked some awkward questions, put them on the spot. And then we're all more than happy to go and sit at length, if you need to go through and answer those questions that you might have. Just come down and have a chat.
Sorry, Jen, somebody's just put in the chat around a link between vaccination and miscarriage. Is there any link between vaccination and miscarriage?
No, and actually, if you look at that evidence from over in America, I'm going to let Susie take this one, actually, but there isn't any.
No, so in America, they had launched the vaccine considerably before we had in the UK. And actually, they had a number of women that they followed up through having had the vaccine accidentally before they knew they were pregnant, and followed those women up and didn't display any increase in miscarriage rates in that population. So women who wouldn't necessarily have chosen to have the vaccine had they known they were pregnant at that point, had the vaccine by accident and suffered no ill effects from it. So I think from that, we can be very confident that the evidence doesn't show a link between the vaccination and miscarriage, which is really good news to hear. I hope that answers the question.
Yeah, very strong evidence there. Was there any other questions that have come in there that we need to answer? We've got the if you'd like to submit any further questions, you can send us an email at nncccg.teen.engagement@nhs.net, or just have a little look on our own website, Nottingham and Nottinghamshire CCG, or access the NUH or Sherwood Forest fertility pages, as we said, the Royal College of Obstetric and Gynecologists, to name a few resources. Or of course just pop down to one of the vaccination centres where there's no obligation, but obviously we do have a free vaccine just waiting for you. Okay. I think that we're going to bring it all to a close. Thank you everybody so much for today, and send us an email if you would like to. Okay.
Thank you, Jen.
Or someone has said something about the Hucknall Vaccination Centre. Is there a GP I can speak to there? There are some pop-ups that are being done by general practice, and I think this may be one of them. So actually, it'll be about a matter of speaking to your own GP if you wanted to speak to GP about the Hucknall Vaccination Centre, because there isn't a vaccination centre in Hucknall from a big massive vaccination centre, but there probably is a pop-up from the GP surgery. So sorry, that's a last minute question I just saw wang in there to me. Were there any other questions that are there, Katie?
Yeah, just one final one is, please can you tell me if having had a COVID case affects my fertility or future pregnancy?
Having a COVID vaccination or having COVID infection?
I think it's COVID infection because it says had a COVID case.
I don't think so. We don't know all the information about COVID and what the effects of having long COVID are, or we do not know. We have a lot more information about vaccination because we've been doing vaccination for many, many, many years, decades. But so although this vaccination is new, we are experts at vaccination. COVID itself is a little bit new. However, we haven't seen a big drop off on our fertility rates here in Nottinghamshire that I'm aware of. I don't know if anyone else.
No, I think you're right. No effects that we know of, although it is early days.
But there is more evidence that long COVID is a complex beast and best avoided if you can. So. Well, we are all obviously very pro-vaccination here, so we would be saying this. But yes, we're very pro coming and getting vaccinated and protecting yourself, your family, your friends, and your children. Anyway, I'm going to go bring this to a close. Thank you, everybody, for being amazing. Unless someone else is going to shout out and say there's another question.
There is just one final one is around what about the opening hours of the walk-ins around the
right,
city?
so the opening hours are varying a little bit at the moment. We were doing 8 till 8, but because we need to make sure that we're concentrating our resources and making sure that we're getting it as the most efficient way, we are dropping those hours down, and it does vary. I will say there is always somewhere that's going to be open between 8 and 8 somewhere. I mean, if we get into the World Cup final, don't quote me on it for Sunday night, that's all I'm saying. But yeah, basically, if you want to get vaccinated, there should be somewhere that's open between 8 and 8. And every vaccination site is open every day. But the hours are dependent, and so it's worth going to that website. We did put the link in it was on one of the slides there. We'll put it back in the chat as well if anyone wants it, so you can just go and have a little look. But if you just have a little Google of book a COVID vaccine, it will take you to the government website and it will tell you where you can book in. But the walk-in sites, the availability of those is anytime that they're open, and you can get that from Nottingham and Nottinghamshire CCG website, COVID vaccination part of the website, and the link is there, magically appeared on our chat right now. Thank you, Katie, you are a star. Any more questions? I haven't seen it go up. Okay, I am actually going to go and bring this to the close now. Thank you so much, everybody, for listening and sticking with us to the bitter end, the slightly phrenic end to our questions, but thank you.